This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
Good morning, and welcome to your Medical Minute. This Medical Minute's going to change your life. Okay, the other day I had a 2.5-year-old male who had sustained a laceration right between his eyes, right over the bridge of his nose, which in a 2.5-year-old is kind of a hairy place to try to sew, requires some wrestling, has some anxiety involved. So we had the parents were doing a great job of comforting him. Of course, he was frightened of doctors and nurses, and the parents held lead on there for about 45 minutes, and then it was time to sew. So we considered that we could have done ketamine and just fully sedated him, but it only looked like it was going to take 2 or 3 sutures. And so we thought, we'll just wrestle this kid. And it was clear from the outline, you can see how the tissue gets white after you've had a good LET application. It was clear that he was probably adequately anesthetized in a local sense. But of course, when we went to wrap him in a blanket and hold him down, he was just screaming his head off and going crazy. Luckily, we had cooperative parents to help out. So in addition to the LET, in these types of situations where we have painful medical procedures for pediatrics, what can we do? What are adjunctive therapies that we can do to help kind of reduce parental pain and anxiety, provider pain and anxiety, and if you have to, child pain and anxiety?
Play Frozen on your phone.
What's that?
Play
Frozen on your phone, right? We can give Tylenol and ibuprofen. Frozen on your phone is great. They've even done studies that look into using like virtual reality headsets for children during their painful procedures. That was in the setting of like a burn clinic where they had to, constantly change dressings. So the parents did a great job at my great suggestion. They did a good job of pulling up on their phone, and they played everyone's favorite Elmo song, La 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 La, Elmo song. That one, which was painful for me, was good for the child. It distracted him. So I kind of went down the rabbit hole of looking at literature. What are other things that we can do? So besides Elmo's song or Baby Shark, what are some things that you can think of that might be entertaining to children but scary to adults that you could do? This is like a guess what I'm thinking. But there's actually a number of great studies in the literature, and I'll just read you this title. A quasi randomized-controlled trial to evaluate the effectiveness of clowntherapy on children's anxiety and pain levels in the emergency department. So this is a study from the European Journal of Pediatrics. And actually, if you look up the literature, there are numerous studies on clown therapy, which I didn't even know was a thing. I want to be a medical clown. So they basically took children who had to have painful procedures, and they randomized them to either entertainment by parents and nurses who we think were really good but were not, or entertainment by professional medical clowns, both in the waiting room and during the medical procedure. And then they had everybody, they used like these well-validated scales of the numerical rating scale and the Wong-Backer scale. These were children ages 4 to 11. And they rated the kids by observers. They had the parents fill out questionnaires. They even had the clowns fill out questionnaires. And I don't know if that was like how painful it was for the clown personally, or exactly what that questionnaire was. But they found in every instance that anxiety was greatly reduced by the clowns versus parents and nurses. Interestingly, the pain was not reduced, but the anxiety associated with the procedure was reduced. And this was kind of across the board for all age groups, even the 11-year-olds who I would think would be a little creeped out by the clowns. But it's just a good idea to remember that, we don't have to just wrestle these kids down and try to power through the procedures. We can send Stephen in as a professional medical clown to help them, and we should use every adjunct procedure at our disposal to help the kids with anxiety. So that's it.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.